Thanks for joining. My name is Jacqueline Plant, and I'm a community program coordinator with Olympic Community of Health, or OCH. Lauren Garrett is also on the call joining me today, and she is our Olympic Connect Hub lead. And today we'll be going over a new funding opportunity from OCH for local resource and service providers to join our Community Care Hub, Olympic Connect, as referral partners. So we'll do a couple things today. I don't expect that this will take a full hour at all, but we'll walk through some details of the opportunity together. I'll share some insights on Olympic Connect clients and just the types of services that they're commonly being connected to. And then I'll also give a quick demo of our shared regional technology, or the platform that you'd be using to receive referrals, which is called Connect2 Coordinator, or we'll call it C2C. And then lastly, there'll be plenty of time for any questions. I'll pause and ask for questions after we review the RFA and also at the end of the session. And then you're also welcome to drop any questions in the chat throughout the session. I am recording this right now, and we'll post the recording on our YouTube channel tomorrow. So, which is why it might sound like I'm speaking to a larger audience than I actually am. But we'll save this for anyone who can't make it today. So let's get started. So I want to start by just kind of reviewing the request for application. So I'm sharing my screen right now. I'm on the Olympic Community of Health website in the funding opportunities section. So I'm just going to open this up and zoom in just a little bit. Okay, so I'm actually going to skip over the purpose and just give a quick little background on OCH and Olympic Connect before I get into the funding opportunity. Olympic Community Health is a nonprofit organization serving the Olympic region, so meaning Clallam, Jefferson, and Kitsap counties, and the 7 sovereign tribal nations of the region. We're one of Washington's 9 accountable communities of health. We were first established back in 2017 under a statewide project to look at how we can better serve community members who are on Medicaid. So our overarching goal and kind of the mission of our org is to improve individual and population health and advance equity by addressing the determinants of health. So Olympic Connect is a service of OCH that was just launched in October of 2024, so still relatively new. And Olympic Connect is a community care hub. Olympic Connect is really what this opportunity that we're talking about today is specific to. We currently have 12 contracted care coordination partners throughout the region who are working directly with clients to connect them with the vital services that they're in need of, kind of under the umbrella of Olympic Connect. So naturally, the next big piece of the development of our hub is to bring on service providers as partners. This is a really, really exciting opportunity, as we've been asked over and over by organizations, service providers, how they can be a part of Olympic Connect, and this is it. So it's a really big step toward our vision of a unified network of partners that are seamlessly connecting people to the support they need to thrive. So we're really excited about this one. Okay, so I'm going to go back up to the purpose and overview. So we're seeking to contract with partners throughout the Olympic region to provide resources and services to Olympic Connect clients through its integrated regional referral system, Connect2 Coordinator, which I'll demo in a little bit. Through this shared platform, partners will receive direct referrals and provide vital services to address the social needs of local community members. The goal of this initiative is to expand access to local programs and services, increase regional data to inform future decision-making and sustainability, and to strengthen a truly closed-loop referral system that ensures no member of our community slips through the cracks. Okay, so what does this actually look like? Let's go down to the scope of work here. So we're asking organizations who are already providing services to enable a new direct referral pathway within Olympic Connect. So we get you set up on our client management platform, Connect2 Coordinator or C2C. We would have, or you would have basically like a referral inbox. Olympic Connect care coordinators would be able to send eligible clients your way using that new pathway. So we would be asking that you would appoint a referral coordinator who is the person responsible for managing the incoming referrals through C2C. This person would receive emails when a new referral comes in. We'd ask that they respond to the referrer in a timely manner within 1 to 2 business days. This person would close the loop on client outcomes by documenting within C2C the status of the referral, just approved, declined, or incomplete. We'd also ask that they communicate any program eligibility or capacity updates with OCH so that we can ensure that the program information is up to date for the Olympic Connect care coordinators. We're also asking that supervisors review and adhere to the policies associated with the platform and Olympic Connect, share about the service they're providing and how to get connected to it with the Olympic Connect care coordinators. Through a partner presentation, we have them pretty regularly, and it's just a chance to share about the program you're offering, and then just maintain general oversight throughout the contract period. Okay, I'm going to skip over eligibility again, just real quick, and just go down to the role of Olympic Community of Health. And I also just want to mention again that this really is a really wonderful opportunity for local service providers. It just means more community members are going to know about and be able to receive the services that you're providing. You'll have access to a secure platform, C2C, to manage referrals and communications, ideally lifting some administrative burden. And as an Olympic Connect partner, you'll also be able to tap into our many shared resources. So we host many trainings and workforce development opportunities, community convenings, technical support, as well as data analytics and reporting that can be used to tell a compelling story about the service that you're providing. Back up to eligibility. So pretty straightforward. In order to be eligible to apply, you just must be an established legal entity within the Olympic region, Clallam, Jefferson, or Kitsap counties, and you're working to advance health through direct support services. You must be in good financial standing, and we're really open to a wide variety of types of service providers. So transportation, employment support, services for aging or disability population, families or youth, support services for folks with substance use disorder, housing, shelter services, anything that is valuable to our community members. And in a bit, I can show you some data on what the types of services that we're mainly connecting folks to. Okay, and then this geographic distribution section. Again, we're looking for service providers in all corners of the Olympic region, and we'll be looking at areas served when making selections just to make sure that there's equitable distribution throughout the region. Okay, so compensation. So the funding for this, it's really just a one-time payment of $5,000 to be paid within 30 days of contract execution. We're really not anticipating this partnership to really require much of a lift beyond the initial onboarding and integration of the new platform, which is why it's just that one-time infrastructure payment. We believe this opportunity is really going to prove to be valuable to referral partners for a lot of different reasons, with the increased visibility, the closed loop communication, and trackable, reportable outcomes. And just as an organization, OCH, we really truly value feedback and ongoing improvement. So we'll be really eager to hear more about what could be valuable to you in the partnership. For timeline, so we're on the second item right now, on the 21st, and we'll be posting a recording of this session along with any updates to the FAQ document by the end of this week. Applications are due by 5 p.m. on Monday, May 11th, and we'll be reaching out to applicants by May 29th on the status of their application. After that, we'll begin onboarding referral partners. So we're looking to contract with up to 30 different partners. So we've split onboarding into 4 groups. And on the application, you can specify which 2 dates would be the best for you. So contracting would take place in the weeks prior to your onboarding session. And we're anticipating that the onboarding sessions will be like an hour long, and it would just take place in our office in Port Hadlock, and it would just be showing you how to use C2C and kind of just going over some policies and guidelines. We have a small application review team who will be scoring the applications based on the following rubric. It's kind of split between a few pages here. I'm not going to go into all of this, but so we'll consider the scores from the rubric, as well as geographic areas served and the type of service provided, any service limitations in making our final selections. So we're really aiming to partner with a variety of partners to ensure services are available throughout the region and that services are meeting a variety of needs. Okay, so if there are any questions, you'll have a chance to ask during this info session. You can also email us at connect@olympic.ch.org. And we also have a living FAQ document that we'll be updating as folks are emailing in questions or asking questions here. So you can take a look at this document too. Okay, so contract requirements. Prior to contracting, we'll certify that the applicant is not presently debarred, suspended, proposed for debarment, declared ineligible, any of that. We're asking that contractors must provide proof of insurance coverage, including commercial general liability insurance and automobile liability coverage. Contractors must provide OCH with a current completed W-9. We process payments electronically, so we'll ask for your banking information for the automatic payment. And then we'll ask that you keep OCH staff updated regarding any staff turnover and absences, which could impact your ability to provide timely referral coordination services. You're required to use the cloud-based software provided by OCH and adherence to privacy and security policies. That's referring to Connect2 Coordinator. And then partners will be required to adhere to the policies and procedures laid out in the Olympic Connect policy manual, which is linked here in the document. Application process is also pretty straightforward. So you can click the link that is on the RFA, and it's just going to download a Word file for you. I don't know if you'll actually see it when I open it, but it'll just download a Word file directly to your computer, and you can fill out the application that way and then just email it to us at connect@olympic.ch.org. Final decisions will be made by May 18th, and we'll notify you by May 29th. Okay, so next up, I wanted to share a little bit of information about Olympic Connect clients, which I think might be insightful. And then I'll give a quick demo of Connect2 Coordinator. Before that, just wanted to check and see if there's any questions on the RFA. Okay, let's keep cruising. Okay, so I just want to give a quick peek of a little bit of data that I think is kind of relevant to this opportunity. So this is data that we collected last year, so it's January through December of 2025. So this first one, this is the amount of clients that we enrolled in Olympic Connect and actually served and worked with last year. So pretty exciting. As you can see, things really ramped up toward the end of the year. Our goal was 1,000, and we surpassed that with nearly 1,400. This year, our goal is 3,000, and we're well on our way. Month over month, we've been seeing a pretty good increase. So we got a lot of folks hearing more and more about Olympic Connect and getting involved. And then as far as demographics of those people, this just shows the ages of those enrolled. Quite a few people in the elderly aging population. We serve some minors as well. And then of course, most people are kind of right in the middle. This is ages 20 to 64. And then this next one shows the geographic distribution of our clients. So we're pretty evenly dispersed across the 3 counties that we serve, with most in Kitsap and Clallam, but got people all over. Okay, and then real quick, I just want to show you some referral data. So in serving those clients, we're connecting them with resources and services in the area, and we document all of that in C2C. So this is the total number of referrals to local services that we made last year. So 1,760. And then of those total referrals, these are the categories of the services that people were primarily being connected to. So you can see that the top 2 were financial assistance and housing. Also high up were food access, employment, elder, disability care, utilities, and legal assistance services. But there's a pretty wide distribution across all of these. And then this one kind of continues on to this next chart right here. We have childcare, pet services, education, clothing. Health needs are a little bit lower on the list, insurance, vision, you get it. So, okay, so that's that. Okay, now I am just going to show you what Connect2 Coordinator looks like and kind of give you a day in a life of an Olympic Connect referral partner. Hopefully I'm still logged in. So this is Connect2 Coordinator. I'm logged in right now as a care coordinator, so I see a lot more information, but I just kind of wanted to show the whole process here of how someone might get connected and make a referral to one of your services. So as a care coordinator, and this is a training environment, so none of these are real people or real information, if I said that. Okay, so as a care coordinator, I can make referrals for my clients by adding them from our regional resource directory. So I know that I have this one set up as referral but we have a pretty robust search system in here. I'm in training, so it actually doesn't have everything that we would have in our real production environment, but there is a copy of our resource directory on our website that you can take a look at. This is something that we maintain religiously every day, and it's kind of a something that's available for everyone, as I said, on our website. Okay, so care coordinators can select resources and services that are appropriate for the clients that they're working with. And usually what they'll do is make the referral in C2C, but then it's a separate step to actually refer them, because if the partners aren't using C2C, they're not going to receive the referral. But ideally, as we onboard resource and service providers, they'll be receiving the referrals. So that's what it looks like for a care coordinator to just search for referrals, add it to the client profile. And now I'm going to log in as a referral coordinator. So as you can see, this view is a lot more minimal. So I'm really only having access to see the referrals that I receive. As I mentioned, it's kind of like a referral inbox. So anytime someone makes a new referral, you will get an email letting you know. So you don't even necessarily need to log in every day and check. You'll get email notifications every step of the way. So I have a referral here that Lauren helped me to set up yesterday with a test client. So when I log in, they're organized by clients. Again, this is all kind of fake information, so it looks a little funny, but typically you would be able to see date of birth, address, phone, email, just kind of the basic contact information. Um, and then I have this task here, referral review, and it's basically telling me to review the referral according to my organization's processes and requirements. So maybe I need to check for an application in my email inbox or within my secure messages here within C2C. Maybe all I need for the referral is just name and contact info for the individual who's interested. Um, but I have the option to select an outcome here, and I have a kind of a custom description here telling me what I need to do for my organization. So I would select my outcome, all of which will trigger an email notification to the care coordinator who sent the referral. And this is where you see that closed loop communication in action. So if I select accepted and processing, um, they'll get an email saying your referral was accepted. Here's what to expect next, or your client can expect to hear directly from them within a week or whatever your typical lead time is. Incomplete, this would send an email to the care coordinator saying your referral was missing some information. Check your messages for some more detail and resubmit. So we're asking here if you do select incomplete or declined, that you just message the care coordinator to let them know. I can see here that this referral was sent from Lauren, who's on the call right now, to me at First Step Family Support Center. And if it was declined, similar, Lauren would get an email saying your referral was declined. Check your messages for more information on why it was declined. And we just ask for clear communication, again, so folks aren't slipping through the cracks and everyone's getting connected to what they need. So I'm just gonna select this, and this is pretty much all it is. So this, what I just kind of demoed now, is a really basic workflow, but it is modifiable with additional steps. So if, for instance, after verifying initial eligibility, you needed to then run a background check or maybe get approval from another entity, we could add another step in there. All of the task descriptions and email notifications are modifiable to align with your program requirements and processes. And then I'll show in here, you have this secure inbox, so everything is encrypted, and this is a safe place to send applications. If you need to include any kind of PHI, this is a place to do it. So I have a message from Lauren in here. She sent an application. I can view a PDF by looking here through my messages. And then you also have access to the resource directory if you want to peruse that. Okay, so I think that is all that I wanted to cover. Looks like it's just us now, so I don't think there's any lingering questions. But yeah, check back on the FAQ. Feel free to email us at connect@olympic.ch.org if you have any questions. Lauren, anything you want to add?
I think I would just uplift again that the referral workflow that you demoed is pretty customizable. So we built just a standard workflow, and we can customize it around each organization's actual referral process, and that's a part of what we do. In the onboarding process, we do a little bit of discovery there to make sure that we're creating a referral workflow that matches how your program does things.
Awesome. All right, well, I think we'll wrap it up. Thanks, Lauren.
Well, thanks.
Bye-bye.